The double-edged sword of mental health labels. Misunderstanding, crazy. Mental health terms like crazy, insane, and unstable have long been used to describe behavior that seems unusual or difficult to understand. However, the careless application of these labels has far-reaching consequences. Mislabeling individuals can harm those facing genuine mental health challenges, discredit intelligent or innovative thinkers, and even manipulate outcomes in legal and societal contexts. This mischaracterization can distort justice, impact public health, and perpetuate harmful stereotypes. Deeper thought, intelligence, and mislabeling. The misunderstanding and mischaracterization of deeper thought and intelligence as mental instability have been recurring issues throughout history. Innovators and visionaries like Nikola Tesla, Emily Dickinson, and Vincent van Gogh were often misunderstood in their time. Their unique ways of thinking, which deviated from societal norms, were dismissed as eccentric, erratic, or even insane. This problem extends beyond historical figures. In modern society, individuals who use metaphorical language to express deeper truths can find themselves mislabeled. For example, someone warning about environmental collapse with evocative imagery might be dismissed as an alarmist, their valid concerns overshadowed by accusations of hysteria. This dismissal not only stifles important conversations but also alienates individuals who could contribute meaningfully to society. Case in point: misinterpreted speech in whistleblowing. Whistleblowers often encounter resistance when exposing systemic failures. If their warnings are expressed metaphorically or emotionally, they risk being dismissed as unstable. This is particularly dangerous in cases where public health is at stake, such as whistleblowers exposing unsafe medical practices or environmental hazards. The dismissal of their claims as crazy talk can delay action, allowing harm to continue unchecked. The legal system, exploiting insanity diagnoses. The legal realm offers a vivid illustration of how mental health labels can be weaponized. The insanity defense is a cornerstone of the legal system, designed to protect individuals who genuinely lack the mental capacity to understand their actions. However, its misuse by sociopaths and manipulative individuals undermines trust in the system. Sociopaths and manipulative defenses. There have been cases where individuals with sociopathic tendencies have feigned mental illness to escape justice. By convincing the court of their insanity, they avoid conventional punishment and are instead sent to psychiatric facilities from which they may eventually be released. This exploitation not only undermines the justice system, but also reinforces the stereotype that mental illness equates to dangerousness or criminality. The consequences of misjudgment. On the flip side, individuals genuinely struggling with mental health may face harsher judgment if their conditions are not understood or acknowledged. The disparity in how mental health is treated in the legal system, overused as an excuse by some and underrecognized in others, creates a system fraught with inconsistency and bias. When victims are labeled crazy, Eileen Wuornos and beyond. Victims of abuse and trauma are often the first to be labeled crazy, especially when their behavior deviates from societal norms. Eileen Wuornos, a woman who endured severe abuse and later became a serial killer, is a tragic example. Her actions were undoubtedly horrifying, but dismissing her as merely crazy oversimplifies the systemic failures that contributed to her trajectory. Understanding the cycle of trauma. Wuornos's life highlights the devastating impact of untreated trauma. Society's failure to provide support or understanding left her marginalized, pushing her further toward violence. By labeling her as crazy, the focus shifted away from the societal structures that allowed her suffering to escalate, enabling a cycle of misunderstanding and dehumanization. Other cases and misconceptions. There are countless other examples of individuals whose actions, while reprehensible, were shaped by their environments and circumstances. Labeling them as insane absolves society of responsibility for addressing root causes like poverty, abuse, and lack of mental health resources. Public health and the ripple effects of mislabeling. Beyond individual cases, the casual use of terms like crazy and insane has broader implications for public health. Mislabeling discourages people from seeking help, fearing the stigma associated with mental illness. It perpetuates misinformation, creating a society where mental health issues are trivialized or misunderstood. Stigma and its consequences. When mental health terms are used as insults, they lose their clinical meaning. This trivialization can deter individuals from recognizing their own struggles or seeking help, perpetuating cycles of untreated mental illness. The stigma also impacts caregivers and professionals who may face criticism or skepticism for advocating for mental health. The marginalization of vulnerable populations. Certain groups, such as people experiencing homelessness, those with substance use disorders, or individuals from marginalized communities, are disproportionately affected by mental health stigma. Mislabeling them as crazy or unstable exacerbates their exclusion from society, limiting access to resources and support. Reimagining society's relationship with mental health. To move forward, society must rethink how it approaches mental health. Labels like crazy and insane should be replaced with empathy, understanding, and a commitment to addressing systemic issues. Promoting education and awareness. Education is key to combating stigma. By teaching people about the complexities of mental health, society can foster a more nuanced understanding of behaviors that may initially seem unusual or alarming. Encouraging empathy and accountability. Empathy requires recognizing the humanity in every individual, regardless of their circumstances. This includes holding people accountable for their actions, while also addressing the underlying factors that contributed to them. Creating systems of support. Improving access to mental health care, social services, and community support can prevent the marginalization and escalation of individuals who might otherwise be labeled as crazy. By investing in these systems, society can break the cycles of misunderstanding and neglect.